Alrighty. So let me start by saying thank you so much, everyone, for joining us on relatively short notice in the morning. Um, this is a really exciting opportunity for us to talk about building something that we've never really had at Whole Washington before, which is a real standing legislative advocacy team. And you'll see that throughout I've been using legislative slash commission because we'll talk about it, but we kind of are increasingly seeing these as a fused strategy and potentially a fused team. So jumping into it, this is my intro slide. It's the same one that it always is, but you can follow up with me over email or you can book a meeting with me. So anything we don't get to today, if you have lingering questions or are wondering what you ought to do next, please do get in touch. It's part of my job. So I would love to meet you and just really, really happy to have you here today. Um, Whole Washington, a lot of you are probably familiar, but we are a C4 political nonprofit, the largest universal healthcare group in Washington. We do have a policy called the Washington Health Trust, and it's currently the only bill in the legislature that can call itself a universal healthcare bill. And we're the only group that's actively building towards an initiative campaign. But we are part of a broader coalition that's already come up called Healthcare is a Human Right Washington. Um, and Healthcare as a Human Right Washington is a grassroots community labor coalition with over 40 member organizations and 20 allied organizations. You can see a few of them below. You might recognize some familiar organizations there. And Whole Washington is a dues paying member and therefore gets to vote on decisions in the steering committee. Um, but the main point that I'm bringing forward with this is that this is actually a very powerful coalition. Their member organizations pay dues, which means that they have some funding. And many of these organizations have resources, whether that be lobbyists or access to research. Some of these are think tanks that can do things like polling and economic research. Many of them have connections to labor. Some are providers. Some are health boards. And so we have the potential to be part of a very powerful group in Olympia. And there are going to be some distinctions between Whole Washington and our team versus the outreach and the collaboration that we do with HICR, which is what we call healthcare as a human right because it's less of a mouthful. Um, but these are the committees of HICR, and you are able to get involved with them. So depending on your interest today and depending on how much capacity we decide that we have at Whole Washington, some of our energy might go towards our own team, and some might be to direct people towards these committees at HICR where they already have the infrastructure to run a team and maybe it's less work for us. So um, the steering committee is probably the most important committee. It's where the broad strategy and decisions get made. The policy committee is very influential. You have very smart policy people on there who know about every single tiny little bill. Um, HUCS is what they call the committee that follows the Universal Healthcare Commission. And so they tend to meet roughly monthly before commission meetings, and that's the committee that Raleigh was talking about being a sort of coordinator liaison to. They have an organizing committee that I think is largely focused on legislative outreach and grassroots actions. A communications committee, which is still forming, but that's largely social media, website, and email types of things, and a budget committee that I've never been to, but for folks who are interested in how the money's spent, it's also an option. So um, these already exist, and that are interested are encouraged to let somebody know, like me or Jen or Rally, and we can help get you plugged in. Um, so starting with, isn't Whole Washington a ballot initiative organization? We are best known for our ballot initiatives, and the answer is yes and. So this is a modified brief history of the sort of universal health care ballot and initiative activity in Washington state. So going back to 93, Washington actually passed a universal health care reform called the Health Services Act, but it was unfortunately repealed a couple years later before it had been implemented. Um, and so in 1999, and I'm not saying this was the first or the only, but in kind of modern history, the 1999 Health Security Trust ballot initiative was the first attempt to get universal health care on the ballot. It was run by our allies at Healthcare for All Washington, and they developed the policy called the Washington Health Security Trust. A few years later, they introduced it as legislation, and they continued to introduce it between 2003 and 2017, but eventually were convinced to drop the legislation and focus on smaller, more incremental goals. 2018 is when Whole Washington runs its first campaign, and we take the Washington Health Security Trust and revise it and update it. And we actually originally call it the Whole Washington Health Trust. And we run I-1600, our first and to date actually most successful ballot initiative campaign. Um, in 2019, after not making the ballot, we worked with Senator Bob Hasagawa to have it introduced as legislation. Um, and I see I have a mistake here. The Universal Healthcare Commission is not created until 2021. Um, but in 2021, we reintroduced the bill. We rerun the initiative I-1362. Um, and the Universal Healthcare Commission is created through Senate Bill 5399. And that Healthcare for All Washington is very instrumental in the passage of the commission. In 2022, we run the I-1471 campaign. That's the one that I was campaign director of. And then in 2023, we reintroduce again as Senate Bill 5335, and we introduced Senate Joint Memorial 8006. In that photo, you can see our first meeting with Senator Cleveland. So it was a meeting with Healthcare for All Washington, Chair Cleveland, and Bob Hasagawa. And this is where 8006 is originally proposed. So then in 2024, this is also where we get invited to present to the Universal Healthcare Commission. So Cleveland writes a letter to the commission and says, please work with Whole Washington. Please look at their bill. And please give them some space to present to you. And that leads us to our historic 2025. So in 2025, we are added to the Healthcare as a Human Right policy agenda. And that really means that it's no longer just Whole Washington that's advocating for it. A much more powerful constituency is able to back the bill in 2025. And that leads to it being reintroduced to a record number of co-sponsors in the Senate. We got 11, including some more influential members on the Healthcare Committee. It also becomes the debut of the Washington Health Trust in the House. It has never been introduced into the House before this year. And you can see Representative Parsley in this photo. She's the one who introduces it. We pass our first bill. So 8006 takes a couple of years to pass. It's reintroduced as 8004 in 2025. But we're able to finally pass it after 3 years of advocacy. The Washington State Labor Council, this isn't strictly legislative, but they did just pass a universal healthcare resolution, including some provisions that they work with the legislature on developing that policy and a strategy to pass it. And then just within the last month, we were invited to participate in a first of its kind advocates roundtable with the Universal Healthcare Commission. Annie is here with us today. She was one of the panelists. I was also a panelist. We had folks like Thomas and Jen in Olympia. And so this photo is the photo we took afterwards with Chair Cleveland and Representative Parsley, both of whom are actually going to be on the commission. So that's the other thing that's not on this. But this year, Parsley is a new legislator. She takes the historic and very brave action of debuting the Washington Health Trust into the House. And within about 6 months, gets appointed to the Universal Healthcare Commission. So she is rapidly moving up as a leader on universal healthcare and getting recognition for it. And we have successfully gotten a powerful advocate of ours onto the commission. So why pursue legislation, just in case it's not kind of implied through that history? The first is that it shows a good faith attempt to work with the legislature. And this is something that is important to the public. It's important to other groups that we might try to work with. It's all well and good to say we want to run a ballot initiative, but they cost millions of dollars. They require people to spend their summers gathering signatures. And so they want to know, isn't it Olympia's job to do this? Why not work with them? Haven't you tried working with them? And we have to show that we are open to that, even if that is one directional. The second is that legislators actually have access to policy development resources, and that's even if we don't have a majority in a committee or to get something passed, we can still work with a supportive legislator on getting access to some of these resources. And this is part of the story of the Washington Health Trust, is because Senator Hasagawa was able to introduce it into the House. It was able to receive a fiscal note from the Office of Financial Management. It was able to be reviewed by the Department of Revenue and the Employment Security Department. So we have better policy because we have introduced into the legislature. The next point is that it's actually legislation that changes policy and gets people health care. And this is not to denigrate our advocacy work or the work that we have spent running initiatives, but to date, we've spread a lot of awareness and we've convinced a lot of people to work with us on this. But it is actually policy that changes those laws and can potentially get people health care. And so we should be very interested in what we can pass through the legislature that can meaningfully expand healthcare and get Washington State closer to a universal system. And so that's the last point. We really could win universal healthcare this way. And it's not just me saying this. Universal healthcare systems across the world have typically been passed through legislation. That does not mean that one way is better than the other way or that we know what will happen, but we have to maintain an open mind. What we are trying to accomplish has not been accomplished in the United States before. And so having multiple strategies and multiple teams is a matter of having a sort of diverse strategic portfolio that allows us to pivot based on where we see movement and energy and interest. What about the commission? It's been mentioned a few times. So the commission was formed in 2021. It's a permanent commission, but it has no deadlines other than an annual report in November to the legislature. They can't pass laws themselves. So the commission, while it is been put into a position of having a fair amount of influence, the influence really ends at making recommendations to the legislature. The legislature appears to take the commission seriously, or at least some legislators do, and we're often redirected to the commission when we speak to legislators. Um, so we consider our outreach to the legislature and commission very, very linked. And so far, we've put a fair amount of effort into the commission, and it seems that we have a good reputation. There are some things they're working on, including a report on the Washington Health Trust. So we had to work with the commission to ask for that report, and then the commission will publish that report. But we hope that it helps us then take that report and influence the legislature. So by building a good reputation with the commission, we will have more influence on the legislature. So is all of this related to the initiative? Is it bringing us closer to a successful initiative? And the answer is yes. Organizing down to the legislative district level is going to help us build a regional structure and build leaders across Washington State. Working with legislators and the commission helps us develop our best policy. People also see this work and respect it. These are public meetings. When we have these conversations, they can tell who's advocating for them and who's advocating against them. And we don't yet have full support from the legislature. In fact, there are members who are very against what we're doing. But the reality is that by working with them, we can reduce and prevent obstruction from the legislature. This is a little bit into the weeds of how initiatives work, but one type of initiative that we are likely to run in Washington involves some amount of participation from the legislature. And if we have done the work ahead of time to build this relationship, the legislature actually could choose to pass our bill instead of having it go to ballot. They could just pass it outright. And they also may have the option to run a competing initiative. But we hope that if they have a good impression of us, they will either not run a competing initiative, or if they do run a competing initiative, it'll be a good one, and it'll be based on what we have fed them through bills in the legislature. And the last is, even if we pass this through the initiative, in a direct initiative, it will still be the state government that implements the system that we pass. And therefore, if we can build supporters within the state government, across agencies and the legislature, we will get a more honest and faster implementation. And implementation is going to be critical to success. It is not just going to be done on paper. So then why are we forming a team around this? And the answer is that there's a lot of work to do. There are 148 legislators, I believe, or maybe 147. Um, uh, so there are a lot of legislators, and we need to reach and educate them. Uh, they are more responsive to their constituents, so it's all well and good for Andre and Jen and Rally to set up meetings with all of these legislators. They will be more responsive to leads from their district, and then to see that there are many constituents and it's not just a handful of people. Um, we also have never had a team like this before, and so every legislative session has been a scramble. What can we do in the next couple of weeks? What are the most pressing deadlines? But really, to make progress on this, we need a multi-year strategy, and we need to create the conditions for universal health care. What does that look like? Smaller steps? Does it mean we start running candidates and applying pressure to our legislators or even replacing them? Can we make tweaks to our bill that makes it more agreeable to legislators? Or do we need to find the right backers, whether that be labor leaders or the right chairs of the right committees? Um, this is what we need a team to sort through all of this, help us figure it out, and then deploy a successful strategy. Um, and the 2026 session is going to be upon us very soon. It's the short session, and there's a lot of things on fire. And so it's going to be very competitive to get time with our legislators. And so we're going to really need to be pushing hard to get into the room in 2026. So a little bit about what a legislative coordinator might do. So the way that we are kind of developing this, and it's all still flexible, so none of this needs to be set in stone. But the idea is if you're a legislative coordinator, you would be assigned a single legislative district. It would be the one that you live in, and that means that you have 3 legislators to track: a state senator, and then a state representative for position 1 and position 2. Every LD has 3 legislators. Your goal is then to start building a relationship with that legislator and their staff, which may mean sending emails, setting up meetings, making political asks, providing information. And really, what we're trying to understand is their level of support, what they're comfortable with, what they're not comfortable with, what they're working on, and what we need to turn a no into a yes when it comes to the Washington Health Trust. Um, there are also opportunities to provide public testimony and written comments. So the commission meets monthly, and every one of those meetings is an opportunity for public testimony as well as written comments. And there are other opportunities for these, including public hearings. When bills are introduced, they take written comments. Um, we also have passed resolutions, including SJM 8004 was a resolution. We passed resolutions through LDs. We've passed resolutions through city councils. So really, I think of this team as the primary team that interfaces with the government or legislators, which makes it different from a sort of grassroots advocacy team that is more focused on community building and the public. And the last is once you have your LD and you've started to establish this relationship with those legislators, your goal is to really find the other whole Washington constituents in that district and help them do the same thing to show that we have that really broad support. And we really need you. So, like I said, we've never had a team for this before. And imagine what we could accomplish if we had that team and we plan ahead and we have a strategy rather than what we've done before, which is always just based on gut and intuition and the most immediate next priority. Um, no prior experience is necessary. Whole Washington leadership has run our legislative strategy for years now and will be very eager to support you and help you feel that you have everything you need to take part in this. We need a ton of coordinators, including a couple leads for this team. So we need coordinators to run specific district outreach, but we need a couple of team leads to run this team and support all the coordinators. Um, and if you go to wholewashington.org/jobs, you can see some listings for the different kinds of positions that we're recruiting for, including these regional coordination positions, but as well as other things. So if none of this is quite meshing with what you're feeling right now, take a look at the other listings. And you might not get the first position that you apply for, but we will continue to have things to do. We will continue to post things on this webpage, and we want to find a good match based on your interest as well as whole Washington's needs. So Thank you, everyone. And I'm going to go ahead and stop the recording now.